with Dr. Leslie Mendoza Temple, who is the chair of the Medical Cannabis Advisory Board for the Illinois Department of Public Education. And so thank you very much, Dr. Mendoza Temple, for being with us today. We really appreciate it.
Thanks for having me. I just wanted to correct it. I'm the recent outgoing chair of the Medical Cannabis Advisory Board for Illinois Department of Public Health, and that just started in September. But I will tell you the story behind that.
Okay. Well, yeah, why don't we go ahead and kick off? That seems like a good kind of segue then. Could you give us a little background in that?
Sure. So, the board, I responded to the call for members of this advisory board, which is a governor-appointed board. You can do this in the state of Illinois and have volunteer for various numbers of citizen advisory boards for various government bodies. And I saw that medical marijuana was legalized in Illinois, but it wasn't available yet. And I thought, oh, look, they're looking for board members. And I put my application in. I got in. And when we had our first meeting, and it was a group of patients, physicians, nurses, a librarian, an ethicist, and caregivers. So it was about 13 of us. We sat down and people put their hat in to be chair and vice chair, and I was elected chair at that meeting. So ever since then, I became the chair of this advisory board. In short, we met 3 times, and we voted on various conditions to add to the existing list of eligible debilitating conditions for the state. So if a citizen has a history of Crohn's disease and it's debilitating, the doctor thinks it's debilitating enough to warrant the use of medical cannabis, then you would certify that patient, and then they would be able to get a card. And so the advisory board would meet and hear these petitions from patients, from the public and doctors saying, hey, let's add migraine to that list. Let's add irritable bowel syndrome, autism, PTSD. And we sat through days of hearing testimony, patients coming out saying, I'm using this, and then looking at the scientific evidence, reading all of that stuff ahead of time, having a discussion amongst ourselves, and then we would vote on each condition. And we voted yes to PTSD and migraine, irritable bowel syndrome, and a host of others that I felt, neuropathy, that I personally felt, and the group felt by overwhelming majority to say we should add this to the pilot program. And every time we had a full list, whenever we submitted these lists to the head of the Illinois Department of Public Health, who would also collaborate with the governor's office, the entire list would be rejected without really much explanation at all, except, so, and that would be 2 times in a row. So the first time around, we were like, okay, it's the first run at the pilot program. None of the product was available, so there weren't enough people that were testing this program out, hence it's called a pilot program. And the governor just didn't feel we're ready to expand this, nor the head of IDPH. So the first time around, okay. So the second time around, the very same conditions were brought up. And as a board, we passed everything we passed before, and then people had added new conditions for the second petition meeting. And so after we agonized over voting on those and submitted our list to IDPH, that second list was completely rejected as well. So following that, you start thinking, what's an advisory board for? We don't have, we can't make laws. We cannot force the conditions to be added to the pilot program. So what happened was a negotiation amongst our lawmakers, the ones who wrote the bill, Lou Lang, for instance, who represents Skokie, came up with a package to negotiate with the governor. It was a bipartisan effort that said, let's extend the length of the pilot program to 2020, because it was going to expire in 2018. Okay. That's really short. And
especially going back and forth, and things are being rejected. There's not a whole lot of time between now and 2018.
Right. Only so they said, let's make this pilot last longer. Can't we add some new conditions? And so it's really interesting how we as a board full of doctors and patients and nurses made a whole scientific review of the literature and listened to petitions. That it really is the lawmakers who make the decisions around here. I learned that in my naive, humble beginnings in government work. I've never been on a government task force. So then between them, they negotiated to add PTSD and then terminal illness, which we never even were petitioned to listen to, which is a great, obviously a no-brainer condition to certify someone for cannabis for. So they passed those two conditions. They just added them and took away some language that made doctors uncomfortable to certify patients, so that doctors don't have to say, I recommend medical cannabis, because that's why a lot of physicians are uncomfortable. We're not educated well enough on the risks and benefits. We were always taught it's a bad drug of addiction. You should avoid it at all costs. And suddenly this new law is foisted upon them, and they're like, I'm not signing it.
Right.
So the language got better. The pilot program was extended. 2 new conditions were added instead of the 15 we probably could have added. And some other important details, like letting the cards last 3 years instead of 1. So it's more convenient for patients. So I thought, wow, that's a really great thing. But in exchange, they are reconstituting the Medical Cannabis Advisory Board and changing the way they meet and how often they meet. So that meant that everybody who was on the board before was instantly, we were pretty much saying, thank you for your service, and we're done now. So that's why I'm now the former chair of the Medical Cannabis Advisory Board, which is yet to still be formed, and I don't know. I encourage people to look at the website. If you're in Illinois, you could actually join this board.
Okay. Well, that's...
Sorry for my long story, but that really is the political background behind all of this, all up front.
Right. Well, that's interesting in the sense that the realization from the medical community and this kind of bipartisan advisory board, because you've got 3-4 different schools of thought there, right? The individuals that need it, the individuals that prescribe it, the individuals that make the laws, but the ability to come together and to get the local government and the statewide government to take a look at these things is a champion or a win from a personal and a professional perspective, because you got a needle to move in a very large condensed haystack there. So I
agree. I'm happy with the changes that were made, even though it didn't happen the way I thought it would, the way it was written on paper, where the way the process was intended. Still, you're right. The needle has been moved. New conditions have been added. And I just hope that we can keep this momentum going.
Okay, awesome. So how did you become interested in kind of promoting or championing or being a part of the medicinal marijuana, movement? And I'm calling it a movement because from a nationwide perspective, many of us know that there's benefit. So that's why I'm calling it a movement. But what inspired you to be a part of this?
What inspired me is when I just came across the legalization piece of news on my internet feed. I looked at the conditions and I said, that is my patient population. Wow. Cancer, multiple sclerosis, fibromyalgia, let's see, another one, Crohn's disease. These are difficult to treat illnesses for many, and I already employ the use of integrative and complementary medicine like acupuncture, massage therapy, stress management, and nutrition. And so I've already been in the habit of looking outside the conventional Western medicine toolbox to help these people not suffer so much and to thrive. So when I saw that now medical marijuana is going to be available in Illinois, and look at the conditions. I said, I had better learn this, because if I don't, I know that I'm going to be approached a lot, and I hate to look like someone who doesn't know what she's talking about. So I studied up, and I saw that the board position was open. And one of the things I do is when I'm nervous about something I don't know much about, I dive into it, and I either write a chapter about it or I join the task force, because it forces me to learn more about it and to become an expert from where I had really very little knowledge at all. Mm-hmm. That was my inspiration, was reading that list.
Okay. So, because that makes me feel like it's passion. It's passion to, help the individuals that are coming in seeking your guidance and your help and your, education, your knowledge, to help them through very painful aspects. And so when I look at that and I kind of say, oh, all right, that's passion. Do you feel, is there a lack of passion to a certain extent in the medical community when it comes to using integrative medicine, using outside of the toolbox kind of things like you said, or that you'd mentioned? Do you feel mm-hmm. that there's a lack of passion, and it's more from an education perspective or mm-hmm. a clinical perspective?
It really depends on who you talk to. So I'm in an academic institution. So we teach residents and medical students through the University of Chicago Pritzker School of Medicine, and I'm on faculty there. And this is something that I have felt, in order to persuade my more dispassionate colleagues who want to see the science, the evidence base for it. There's definitely that group of folks, and those are going to be physicians who are not comfortable certifying patients. And by the way, we don't prescribe marijuana. We certify patients for eligibility to get a medical marijuana card. Mm-hmm. So that's really important. No one prescribes, because otherwise we're violating federal law. Mm-hmm. So I have those colleagues, and so my work has been to present grad rounds and to give academic lectures to the Illinois Academy of Family Practice and webinars. And it's a slow run, but at least if they hear about learning more about it, doesn't mean they're ready to sit and write certifications. Mm-hmm. And then I have a handful of colleagues who are really excited about it, yet at the same time they're nervous about getting a reputation for being a marijuana doctor, like i.e. in California, where it seems like it's pretty much a joke. You just go in there and say something hurts, you pay some money, and you get your card. And so I think that the Illinois laws, while they're very strict and pretty cumbersome, I think they're great because they help really weed out people who are, just not looking for it for really medical benefits, or they haven't really tried a whole lot of things. Maybe their condition's not so debilitating, or they don't really have a condition at all that qualifies. Whereas with Illinois, the process that patients have to go through really helps select out those who need it the most. Okay. So although it created a bit of a bottleneck for I think for the industry, because it takes a lot, there haven't been as many patients certified as they would have liked, because then business is slow. At the same time, from a medical perspective and safety perspective, I think it's more prudent to go about it slowly and rationally and see how things go. I think that's how the lawmakers intended it to be, not just open it wide for any condition like other states. So I think I might have lost you a little.
Actually,
okay, yeah,
we're here. But if you wouldn't mind repeating that, so that I can, or the last 5 minutes, I'll edit.
Yeah, did I cut in and out?
Yeah, you did. That's okay.
Oh, I did. Bummer. I was trying to find that spot in my house. Oh gosh, what did I say?
That's okay.
You are going to cut and slice, I hope.
Yeah. I can go ahead and edit that part out, so no problem.
Okay, gosh. I sort of came into the streaming consciousness of thought. Maybe I can come up with it a little later, but boy, I don't know if I could do that one again.
No problem.
Maybe if we could move on to another question, then I might go over that.
Absolutely. Yeah, because
okay, thanks.
I do have a question about do you think that if the pharmaceutical companies kind of came on board to champion this effort, right, that there could be more movement?
Oh, yes. I think that allying with our pharmaceutical industry it has the potential to help make their drugs less toxic if we're using lower doses and ameliorating side effects and helping improve the patient's overall outcomes, like with reduction in pain, better function, while using their medications in a rational, sparing setting, and using complementary integrative therapies, which includes acupuncture, massage, stress management, meditation, nutrition, supplements, and possibly medical cannabis. That's what I have been doing already. And I have noticed of my patients who have chronic pain, they are sleeping better on that combined approach. And then they start to feel some hope and some pain relief because they got a decent night's sleep for the first time in years. So what I look at in terms of helping drugs feel safer is if you can lower the doses, because I'm an integrative medicine physician, which means that we use whatever works. We don't throw out medications. We don't throw out the possibility of getting surgery. Not at all. I say use what works from whatever realm, but go with the least harmful first if that's the right call. If a person has an appendix that burst, I'm not going to throw herbs at them hoping it will go away. I'm going to send them to the ER, and they're going to get surgery right away and antibiotics. And then after their recovery, we'll use herbs and probiotics to nurture that healing. So that's my approach to pretty much all any condition or any patient that presents a problem coming to my door. Go for the low-lying fruit, the stuff that's safe, because so much of disease is stress-related. So you got to figure out a way to help knock out that factor as much as possible, and then see what you have left and work with that. Mm-hmm. And sometimes marijuana is the initial solution while we work on everything else.
Right. Okay. So I'm going to switch things a little bit. I saw in some information that you'd sent over, I guess a program that you work with or have been involved with called Sponsor a Patient?
Yes, Sponsor a Patient, yes.
Yes.
Love to talk about that.
Yeah, if you could give us some insight into what that is and how you got involved.
Okay, so at North Shore University Health System, which is the large medical system of 4 hospitals, many physicians and patients served, we have the Integrative Medicine program. And through that program, we offer acupuncture, massage, physician consults, talk therapy, and nutritional herbal supplementation, none of which profits any individual, by the way. And many of these services are largely not covered by people's insurance, Medicare, or Medicaid. So the people we see have been paying out of pocket historically. They pay cash for their massage. They pay cash for their acupuncture. And that's true pretty much everywhere you go in the United States. And there are some insurance companies that are picking it up. But by and large, the majority of people are paying cash out of pocket, which means, well, this is kind of medicine for those the haves, people who have the money to do it. And then it leaves out a big portion of folks who can't afford this out of pocket. So what we did was we started a program to help fund free patient care, like 6 treatments or 10 treatments at a time, so they can at least get a course of acupuncture or a course of massage therapy. And help relieve their chronic symptoms. It's not by any means like the permanent solution, but at least they get a very good taste of what it's like. And we raise money to help pay for those treatments, because the practitioners provide those, and with the hopes that we can, gain more funds so we can give away more free treatments. We love to give away free treatments, but you kind of need money for that.
Yeah.
The practitioners do a lot of charity work and, a lot of philanthropic stuff, but, at the end of the day, they still need to make a living. So if you want to have a robust practice of it, then you get a big pot of money, and then you dole it out to people who are financially qualified. So that's it. And we don't advertise it a lot, because the money that we've made isn't, we don't have millions of dollars in this fund. So if anybody is interested, please let me know.
Okay, that's good.
Yeah.
I like that, giving away that feel good component, and it really touched on I really focused on what you were saying, is that some of the integrative medicine practices, so like acupuncture, massage therapy, things like that, are traditionally thought of as the rich person's luxury, right?
Mm-hmm.
And so it's really out of scope for some of those that really are in need of those types of treatments and could really benefit from those types of treatments. So I think that that's a beautiful project and association that you are involved in, because it really starts to open things up, and make it more equal, a little bit at a time.
Well, what I'm hoping as a tie-in is that we will get support from the medical cannabis industry in Illinois as they continue to get their feet, planted in their business model, starting to generate profit and to literally share the wealth. Because one of the important things they're supposed to do as an industry is give back to the community. And I think they already do, but trust me, I will be asking.
All right.
It just serves their patients, it serves our mutual patients. And, what's interesting about integrative therapies is that it actually doesn't cost that much. It's low cost compared to what we do in Western medicine. If you're going to get an MRI, it could be $1,000 for that one test, covered by insurance. It doesn't make you feel better. It gives us important diagnostic information. It's absolutely critical for patients. But, boy, that $1,000, if you took that and you gave it to a patient and you said, use this for feeling better, that would cover about 4 months of acupuncture once a week. Mm-hmm. So, you think about the expensive tests and medications that we have. Integrative therapies are low cost. But the thing is they're not low cost to a person who's making $40,000 a year and spending $80 on an acupuncture session once a week. They're spending $850 for 10 sessions. And that's a lot of money if that's exceeding your monthly income. So everything's relative, for sure.
Exactly. That also kind of leads me into another topic with Mingle Juice Bar.
Mm-hmm.
I see that you have an involvement there. You are owner or co-owner of Mingle Juice Bar. Can you, obviously it's about juices.
Yes. So let me elaborate on it. So part of it was I call it my midlife crisis, in terms of I wanted to do something creative and explore doing something daring, and I should have bought a sports car instead, but I decided to open a juice bar with my partner Kim King, who is the one who really brought that idea to fruition. She lost 100 pounds doing her own juicing regimen and felt so much better and healthier, and she was sharing her juices with me. I'm like, this is delicious. This is when the juicing craze was really not early on, but sort of in its childhood phase, where there's a lot of juice bars in New York and California and a few popping up in Chicago. And I thought, we have nothing in Glenview. Everything's on the lake and in the suburbs and in the city, but we don't have anything west. And I selfishly wanted to just be able to drop in and grab a juice somewhere. So I opened one up really close to my work in the Glen Town Center. And it's now been 2.5 years of hard work. I never realized how difficult running a food business is, but really, oh my gosh, really hard. And I didn't want to price things like I see from the other juice bars I've seen in the area and in the city. So we work really hard just to pay our bills. But I think it's been a valuable service to the community. It's provided jobs, and then I get my breakfast every morning, selfishly. But I think that it's really helped a lot of folks to have a place to just drop in and get a cold pressed juice, an acai bowl, chia pudding, soup. I mean, we have to move with people's preferences and tastes, but we try to keep everything as organic, as preservative, well, definitely preservative and sugar-free as possible. That it's an ongoing project, that's for sure.
Mm-hmm. Well, what I love about, the three kind of topics that we've talked about, from the advisory board, so legislation, to the sponsor a patient in integrative medicine, and then all the way down to the ingredients with Mingle Juice Bar. It's interesting how you've been able to combine an entire ecosystem, the different layers, right? Of what it is, your calling is, as I see it, to help the community, but to help the community on three different layers. And I think that's pretty marvelous. I don't know if you ever thought about it that way.
I don't know. All I know is I'm really tired. But, it's just sort of there's anything that you fuel with passion, there will be probably some pretty good things that come out of it. My risk is becoming unbalanced with respect to doing too much. And I have to practice what I preach. I also have 3 children and a husband, and it's making sure that they're also definitely cared for, keeping my kids alive, that kind of stuff is important. So I don't know. I think I was blessed incredibly with good people around me who help me do the things I need to do that I don't have time to do, and I definitely don't do them perfectly. Yeah, I love sweets, and I love to eat what I want, but at the same time, I know that if you do too much of any one thing, you're going to get imbalanced, and you run the risk of getting sick, either emotionally or physically. So keeping everything in balance, saying no to certain things, and after a while, I have to stop taking up projects. So I think I'm good with those. I like how you identified those 3 realms, because I think that's my sports car right there.
All right. Okay. Well, to kind of wrap up here, can you tell us about the class that you'll be doing with the Infinity Foundation in December?
Mm-hmm. Yes. So that at the Infinity Foundation, I'm going to be providing a workshop on the physiology of the endocannabinoid system, which is our body's, every mammal has this. We're born with a system that helps us eat, sleep, relax, protect ourselves, and forget pain. And it helps with our day-to-day activities. And marijuana is something that influences that system because it looks exactly like many of the compounds we make naturally. We make our own homemade marijuana-like substances in our body to do those functions I just mentioned. So I'm going to go through the physiology, where in the brain we have different functions are responsible for movement, and why does cannabis work for Parkinson's? Because it has an influence on the cerebellum, where we have CB1 receptors. So I'll get a bit into the science. I won't be too thick unless people ask for it. I'm going to go over the different strains and the methods that people can use it. And I'm going to talk about the literature, the research, or the lack thereof, for various conditions and the politics, which I did share with you, and throw it open for questions. I find that many of my lectures end up being just an ask the doctor kind of session, but that's going to be all things medical marijuana.
Okay. All right. Well, I am looking forward to hearing about how it goes and the session in December.
I have one more disclaimer I have to say so I don't get in trouble with my bosses, is that when I say I'm with the University of Chicago, Pritzker School of Medicine, and North Shore University Health System, and I'm actually speaking on my own. I'm not representing their views, because all of the medical systems in our state are either refraining from making statements about it because they're still evaluating where they stand with all of this. So it's important for listeners to know that I'm speaking from my own experience, but I am a part of those institutions. there. This is so I can keep my job.
I hear you. I hear you. I completely understand. So I will definitely make sure that we have that in there, because we need you to continue to have the platform to continue these awesome things that you're discovering and sharing with our community and with the medical community. So I kind of look at you as a educator a professional educator in the medical community. So I think that, yes, we definitely need you to continue to be there.
Thank you.